All right, so we're going to get started. Everybody, welcome. Happy New Year. This is a great turnout for the beginning of the year. My name is Judy Mark. I am president of Disability Voices United, which is an organization that was founded by people with developmental disabilities and their family members. And we are the organization and the individuals who really helped to get the self-determination law passed and have been working very hard on the implementation over the years. We run these SDP Connects. Probably this year will be every other Wednesday. We started with every Wednesday and now it'll probably be every other Wednesday at this time period. And we'd love to have you all, and we discuss lots of issues. You'll see in the chat at some points, Ed will put it in there. Ed Herzl, our program assistant, will put in where you can find all the past SDP Connects. There are so many, and we've covered virtually every issue you could possibly cover. We're probably going to start over and start covering them again from the beginning because this is a very, very big year. This is the year that SDP goes statewide and everybody gets access to it starting in June. But I'm wondering, and this is something that I totally didn't ask in advance, so she can say no. I'm wondering if Lavisa Bhatti is in a position to speak for just a minute about the vaccines, because I don't want to lose this opportunity with a captive audience of 56 people. Lavisa, are you in a place, I don't know if you're at work or where you can be to talk?
Yes, I can. So give me like 2 minutes. Okay.
Okay. All right. So I'm gonna talk about something related to the vaccine that doesn't need to be a doctor saying it. Lavisa Bhatti, Dr. Lavisa Bhatti is an infectious disease specialist whose patients have developmental disabilities and is an expert on everything. And this wasn't meant to be a vaccine thing, but Lavisa is also her son's in the self-determination program, and I've decided we have to talk about vaccines all the time. But let me tell everybody just very quickly that the Department of Developmental Services today put out some very important information. And that is they created 3 letters that you can print out and bring to a vaccine distribution place where you're going to get a vaccine to provide proof that you are eligible to receive a vaccine. And these 3 letters are for, I should probably look again. One is for family members. One is for service providers. Hold on, let me see the 3. One is for direct service employees, so people who provide direct assistance to people with developmental disabilities. One of them is for family members who support their family member directly with a developmental disability. And the 3rd are for certain regional center employees who have direct in-person contact with people with developmental disabilities. I'm going to put in the chat the link to these letters. These are really important letters because you may need them when you go to get your vaccine if you don't have a pay stub or any other way to prove that you are eligible for the vaccine. So I wanted to tell everybody that because that is really important information. In addition, I've asked Lavisa Bhatti, Dr. Bhatti, to just say a few words because so many people, I don't want to open it up to a million questions, but a lot of people have asked questions and have had concerns about getting the vaccine and just wanted her to reassure you. I had the vaccine, how many days now? 9 days ago. I had very few side effects, a little bit of a soreness in the arm for about 48 hours. And I have felt great ever since and feel at least I'm starting to get partially protected. So go ahead, Lavisa.
Yeah, hi everybody. So I am an infectious disease doctor. I got my vaccine last week. So I think that's a pretty important idea that everybody, all my colleagues who practice infectious diseases have gotten it. And I think all of you saw Dr. Fauci getting it as well. There are two main vaccines that are available for us right now. There's many more coming. This technology that a lot of people have raised questions about is not entirely a very new technology. It has been used for different aspects of therapy before. I wanted to kind of address one thing that a lot of patients have said, that it's going to alter our genetic code. And I want to really explain that it's an RNA vaccine. And what the RNA does, it doesn't enter into our nucleus, which is where the DNA is. So that's an important thing to reckon. And it's degraded very quickly. It just sets up the body in a way that it produces the protein that we can then mount an antibody response to. In you always weigh the pros and cons. What is the benefit versus what is the risk? The risk of getting COVID is really high, especially for us that are here in California, actually anywhere right now, but specifically in California, because now nearly we have 1 out of every 4 people testing positive. Now, this is a virus that is changing itself. So I think that it's really important that we get vaccinated, because in that case, it's kind of similar to think of it like the flu philosophy, that when a lot of people tell me, well, I'm not going to get the flu vaccine because I got the flu anyways. But the important thing with the vaccine is that it decreases the response of your body in a manner which would be harmful to the body. So even if you get exposed to the virus again, you're not going to have any significant disease. That's the most important thing to remember. The other thing also is that it's our responsibility to protect all of those around us as well. So it's fair. I mean, like, the millions of people have gotten this vaccine. They are minimal side effects, and it's the main side effect has been an anaphylactic reaction, which is, I think it's actually around 10 or so. I'm not sure of the exact number, so I'm not going to say the number. Um, but that is similar to what you would have with, there's people that get penicillin injections and they can have a response. All of us are prepared to treat it. Nobody has died. So that's an important thing. You can have an allergic reaction to eating peanuts. It's not something that one can really predict. But that's an important thing. People who have had anaphylaxis before or have a history of a severe allergy should not take the vaccine in a facility where there is no physician present. So if you decide to take it, people with significant allergies must do it in a place where there is some safety precautions. Um, I think that's pretty much all I need to say. I mean, I really recommend getting the vaccine. That's the bottom line.
Thank you so much, Lavisa. I think that one of the questions that came up in the chat is, when are our adults with intellectual and developmental disabilities able to get the vaccine? And what I can tell you, and I don't know if Lavisa knows anymore, what I can tell you is there's been a lot of organizations who have been advocating for this. To me, it is just ridiculous that my husband and I have gotten vaccinated, and my son, who's so much more vulnerable than we are, has not. It's very scary. He's out in the community way more than we are, because he doesn't like sitting at home. And so he walks around everywhere with his aide. And it is something we've been advocating for. Right now, Governor Newsom has not made our community a priority. And I think that we can certainly join together and advocate to him by writing him, emailing him. There's a letter that DRC and the state council have been sending around that you can sign on to, which is asking for our community to get vaccinated. I know that in other states, our community is a priority, not in California. So, you know, what I would recommend is that all the people who are surrounding the individual with developmental disabilities, the parents, other caregivers, respite workers, supported living services providers, self-determination staff, everybody get vaccinated, because you're all eligible to get vaccinated. and that way, at least we will not be giving COVID to our child, to these individuals we care for. So I would recommend you do that, and that we just continue to advocate to get our folks, our community on that list.
My understanding is that there is going to be vaccination available for people that have significant issues like cerebral palsy, epilepsy, but interestingly, they haven't put intellectual disability or autism on that list, which needs to be there. So I think that intellectual disability puts somebody at much higher risk. They're not cleaning their hands and washing their and wearing masks and all of the things that they should be doing. So they are mostly at higher risk. So far, that's what's happening. And I think there's a move to add every person who's on the regional center to be able to get the vaccine. Hopefully that will happen.
Right.
We had a meeting on that today, so we'll
Right.
see.
Somebody's also asking if we know which medical facilities are giving the vaccine with a medical staff available. I mean, you know, this is a big state. So, and in each county, they're running the vaccination program. So it's really hard for me to say, Jan, exactly which place is the right place for you to go to. I can tell you in LA County, I know you're out in the Inland Empire, but in LA County, as a healthcare provider, there's a long, long list of places to get it. And some of those places, it says, you know, being run by the local fire department. That may be something you're comfortable with, because they certainly know what to do in emergency. But there's also places, and there's also like CVS's, which I would be probably less confident in. But I know that there's a bunch of doctors' offices that are giving the vaccine as well. So, you know, I got mine at a sheriff's station. So it's like, you just don't know where you're going to get it. There's definitely a registered nurse on site, and an EMT on site at all of these places. And they make you wait for 15 to 30 minutes after you get your shot to make sure that you don't have, you don't have an allergic reaction. Somebody's asking, did you say adults with epilepsy can get the vaccine? Not yet. Parents of adults with epilepsy or parents of children with epilepsy can get the vaccine, but no one, self-advocates, people with disabilities have not yet been called up. When we're hoping in the next phase that they will get to the group of people with underlying health conditions. Right now, they've just said everybody 65 and older. And not people with the underlying health conditions quite yet. We're hoping that they'll get to that next group in the next few weeks. You know, it's just really hard to know. They need to hire a bunch more healthcare workers to give the vaccine as well. So I'll repeat it again, because people are asking questions that I've already talked about. So I'll repeat again. If you look in the chat, at the very beginning of the chat, I have, I put a link to a letters that just came out today by DDS. You can bring the letters. You can print out the appropriate letter. There's one for a family member, one for a direct support professional, like a respite worker or supported living provider, and one for certain regional center staff who work directly with consumers. And you can print out that letter and bring that with you to the vaccination site, and that should do it. So, and if you're that, because these are for people who are unpaid. If you are a paid IHSS worker, if you are a paid provider, you can just bring a pay stub, and that is completely sufficient. All right, so we're going to move on to the amazing, so people are looking at the site. And so I just want to make sure you understand the site. The site says, you go to the site, you scroll down on the link that I put in there, and it has letters. It says frequently asked questions, which is also good to see. But then scroll down to the next section. It says letters from DDS clarifying COVID-19 vaccination eligibility for phase 1A. All right. That's what you're looking at. Okay, so now we're going to move on to self-determination, which is the reason why we're here. This is a huge year. 2020 is over. Hooray. So this is a huge year, and in 2021 is when the self-determination program is going to be offered to anyone interested and eligible. Let me just clarify what it means to be eligible for the self-determination program. So little babies who are in the early start program under the age of 3 are not eligible for the self-determination program. If you have to be what's called a Lanterman Act eligible as a child, a baby under 3, basically. And those are pretty exclusively individuals with Down syndrome or, very severe at birth injuries or disabilities. Because autism is not going to be Lanterman Act eligible. Neither is intellectual disability, because those things are harder to diagnose before the age of 3. So who else is not eligible? People who live in intermediate care facility or a kind of congregate type setting where they don't get to make their own choices in their life. For example, they live in a group home that is where they don't get to pick what they want to eat every day. They don't get to choose their staff. They don't get to choose their room or their roommates. You have to have free choice in your life. So where you live is also a critical way to be in self-determination. You can use self-determination if you want to move out of that congregate setting, okay? So it's so everybody in the state is going to be able to get into self-determination. The vast majority of consumers over the age of 3 are going to be eligible for the self-determination program. And one of the things that I just wanted to talk about today, and we've invited Rick Wood, who is the co-chair of the Statewide Self-Determination Advisory Committee, to have a discussion with all of you. Many of you I know sit on your local advisory committees or chair your local advisory committees. I recognize a lot of the names, but I wanted to have a discussion today, sort of a back and forth about what we think 2021 is going to look like. We know we've had a lot of problems just getting the first 2,500 people in. The latest numbers from November were pretty dismal. They were a little over 400 people got into the program. I know that a number of people came in January 1st, but even if we're at 450 or 475, it's still a very low amount compared to I think there's about 3,600 people who have been selected. Even though it's only supposed to be 2,500, they over-selected. So it's a very small amount, and we've noticed just a huge amount of barriers. It's something that Rick and I have been advocating on, and many of you here have been advocating to reduce those barriers. So we now are having this problem just getting 2,500 people in, and now we could potentially have thousands and thousands of people wanting to go in who are going to be facing the same barriers that the rest of us have been facing. And so just kind of wanted to have a discussion about where we see things going, and want to engage all of you in these efforts to really work with us on it. So I guess first I just want to introduce Rick, and if you just want to kind of say something at the beginning, and then I can just sort of guide the conversation.
Yeah, sure. Thanks, Judy, and I'm happy to be here again. As some of you know, I co-chair the Statewide Self-Determination Advisory Committee, which is a committee made up of the 21 chairs, or the chairs of 21 regional center local advisory committees. I chair the Kern Regional Center local advisory committee, and have been engaged in self-determination for a very long time, because Kern, or my area of Kern, was one of the 5 original pilots that were begun in the year 2000. So it's now been 21 years that my 25-year-old has been in self-determination. In addition to that, of course, I've worked with Judy as one of the founders of Disability Voices United, and have been very actively involved with DDS in the waiver application, as well as the implementation of the waiver. So, Judy, a couple of comments that I have, maybe to open the discussion, or perhaps not. But since I have the floor, I want to mention to everybody that one of the things that I committed to doing last February when I became the co-chair was to visit all of the 21 local advisory committees at their meetings. And I'm getting there. I haven't gotten to 21 yet, but I've seen committees operate all over the state. And I have seen the committees exercise different roles, different relationships with regional center staff. I'm very familiar with the barriers because I am the one who drafted the barriers report last August. I have to give Judy a lot of credit for this because she drafted the original barriers report in February that ultimately went through a vetting process, including through the statewide committee. And one of the things that I'm finding, other than the dismal enrollment rate, is that the barriers are systemic. The barriers are the same everywhere. Some regional centers are better than others. Some regional centers are more committed, more passionate. Some are more resistant. Some individuals within regional centers are more resistant than others. There's a whole variety of things out there that are preventing people, or at least slowing down the process of people who want to become part of this. So now we're 5 months away. Now less than 5 months away. It's June 7th that this thing goes statewide. And one of the concerns that DDS has is that the system is going to be overwhelmed, which I just find striking, because what they really mean is they think there's going to be a flood of people that want to get into the program, and regional centers are not ready. And I can tell you that regional centers aren't ready. On the other hand, we've not been able to get but 400 out of 3,600 people into the program. And so what I want to emphasize today for those who are either stuck, meaning trying to get through the process, or who are regional center staff, or importantly, who are local advisory committee meetings who are on this call, and I see some, now is the time to begin to push to get people into this program. Why is that? Because the more people we have, the more experience there will be, the wider, a broader participation there will be. Data will be collected with respect to how it's going, whether it's going well, poorly, or not at all. And I don't make this as a general statement. We have a sub work group, or a root work group, which is a subgroup of the statewide self-determination advisory committee, consisting of 7 people. Judy and I are on that committee, and we run a meeting about every month. And one of the things we decided to do at our last meeting is to encourage all regional centers, all local advisory committee or committees, to get themselves and or family members into self-determination by March 1st. That's a goal. And it then goes from there, because once people are in, it catches on. I know that from experience. I see it throughout the state. But it's going to be really important that we develop the data that is not dismal data, that we've got 1,000 or more people in by June, so that we can really begin to see what this program looks like. To the extent that the regional centers might be overwhelmed in June, well, I would hope that's a good problem. Although one could argue that DDS will say, hang on a second, we're going to have to delay this in order for regional centers to get their act together. It seems complicated. It's a new program, which therefore could be argued is complicated. But I can tell you, and Judy can tell you, and others on this call who are in can tell you, it's not that complicated. It is a program that simply, there's a structure surrounding this. Orientation, development of a plan, selection of an independent facilitator, or the use of a service coordinator to assist in developing that plan, creating a spending plan, getting a budget in place and certified, and then obviously going live. So those are just things that are on my mind for the next 5 months. It's really time for a push, a hard push by those who have the capacity to do so.
That was great. You said that. I had to say that on my local advisory committee meeting last night, and you said it so much more articulately. So we are here to once again help those of you who have not moved into the self-determination program move into it. who have been accepted for the phase-in period. And then for those of you, I recognize some of my friends who've never been on SDP Connect before, who are maybe getting ready for the June rollout. You all may have some really basic questions about the self-determination program, which Rick and I are really happy to answer. I also want to give a chance to those others who are here, who are on the local advisory committees. I want to give you a chance to also talk a bit about how you see this rollout going. One of the things that I can mention is that two exciting things that I can tell you about. One of them is that Disability Voices United is going to be holding a statewide sadly, virtual conference. Our conferences have always been in person, and now they are going to be virtual from April 16th through 18th in the morning. So a Friday, Saturday, and Sunday morning. And we're using this incredible platform called Socio, which will hopefully give you as close to an experience as you can have without being there in person, by allowing you to have side conversations, by allowing you to create a meetup. Like, I want to meet up with parents of small children who are going into the self-determination program, or how about a meetup of all the Fresno people? So we're going to have great sponsors, amazing speakers, and registration will be available next week because we're doing it through our Socio platform, and we just got a very long training on it yesterday, and it's going to be super awesome. So registration will come out next week, and we are super excited to present that to you. The other thing that I wanted to say is that we have produced this book called Thinking Outside the Box, which is really a comprehensive manual on the self-determination program. And I'm going to be updating that manual for the self-determination conference. It gets updated every time we have a conference. So if there's like a year and a half, it gets updated year and a half later. So it'll have all the latest directives, all the latest information that we can get on the self-determination program. And for your registration fee, everybody gets a free copy of the book, and it will be mailed to you before the conference. But if you'd like to get a copy of that book right now, by the way, you can do that on our website. Ed may have already put it in the chat, but you can, if she hasn't, then if you could do that, Ed, that would be great. So those are some definite ways for you to start getting prepared.
Question.
Yeah, hold on real quick, Todd. Thank you, though. The other thing that I should just say real quickly is that when we met last night at the Westside Regional Center's local advisory committee, we had our executive director speak at the beginning of the meeting, and we asked her, what are your plans at your regional center to roll out self-determination in June? Because now is the time to start asking your regional center those questions, not in June. It's not like on June 7th, the regional centers will start their planning for the hundreds of people at the regional center who want to go in. Now is the time to be planning for it. Now is the time to be training all of the service coordinators on what the program is. Right now at our regional center, we have only like 5 or 6 service coordinators who have self-determined clients. And of course, come June, every service coordinator is going to have a self-determined client. So they really need to understand the details. The other things we have to figure out before June that we talked about at our regional center is, number one, to try to get rid of some of that bureaucracy, so that when people want to change their spending plans or do certain things, that is streamlined. And we have to figure out how to streamline the process before we have lots more people. And we were really lucky. We had the chairs of a bunch of local advisory committees at our meeting. And we've decided, and I forgot to tell you this, Rick, there's a group of us who are going to start working together to recreate the orientation for the mass amounts of people who want to go in. Currently, the orientation was produced by DDS, and it can run up to 6 hours long, and it's overwhelming to people. There's 23 slides on the FMS alone. It's ridiculous. So we are going to form this small group. We're going to explore what we know some regional centers have actually already started doing this. We know that some independent facilitators facilitators are starting to create some little short videos, and we're going to have a combination of videos that people can go back to and watch over and over again, short bursts of trainings so that nobody's sitting there for hours and hours, as well as if people need it, sort of, one-on-one assistance through our local advisory committee. So we'll keep you informed, and we really want to work closely with the statewide advisory committee to produce those, the new orientation. So I see like a couple of people already have their hand up. One, Todd Rubian wanted to know what the fee is going to be for the conference. So the conference is going to be $50 for self-advocates and family members. It basically is just because the conference itself is going to be quite expensive for us to run through this platform, but we're hoping to get underwriters and sponsors to pay for that. The $50 is basically paying for all the fun things that we're going to mail you before the conference, which will include your the manual. We'll also be sending you a copy of Profiles in Self-Determination, which gives you like individual stories, as well as a conference t-shirt. So we're going to try to make it as if you're actually at a conference, even though you're actually not at the conference. That $50, by the way, can be paid for, will be vendored with the regional centers. So if you're in the traditional system, you can just use your conference funding, or if you're in the self-determination program, you can just bill your FMS, or we can bill your FMS for the conference fee. Professionals would be slightly more at $75 per person. So let me go to all the questions. Eunice, go ahead, you start. Eunice, are you there? You are muted, but your hand is up. There you are.
There you go. I'm so sorry. Yes, we are so happy because we finally, after so many problems we were having and that they were preventing us from get to the self-determination as we were. Right now we're stuck because my coordinator, my representative from the regional center quit or left, and then we were like in the middle of this, trying to have our budget approved. So they gave me a coordinator from the Valley, from San Fernando Valley, which she's wonderful, and she helped us, went through, and our budget was approved. But right now we're still stuck. We haven't done nothing because right now they are taking me away from that coordinator that already met with us and already know Jasmine through videos and all that. And now they're assigning me a new coordinator from the regional center here in Palmdale, which I told them, why are you guys doing that? Somebody totally new. We're already stuck. We already have met Diane, that is being great and approve our budget. And now just for the IPP, you're going to go back with a new person. And I say, why we don't keep Diane? And they told me that no, I cannot keep the person they assign me first. That is a person to have experience with self-determination. So at this point, I have a new assigned coordinator that is going to do an IPP. My question is, even though our budget was approved and we are just ready to start, how can we start? We had to have this IPP first to start with self-determination. I am very confused on that.
I don't think you do, Eunice. Have you already, so you've gotten your budget certified. Have you created your spending plan yet?
We tried to talk to one of the representatives from the spending plan, the what is it called, CT, that he was going to, they were going to help us, but.
Are you talking about the FMS?
Yes, FMS.
Oh, okay, that's different than your spending plan, but go ahead, yeah.
Yeah, we already have gotten together with the spending plan.
Oh, okay. So
We
you
did-
have figured out what you want to spend your money on your own. So what you do is you figure out, you get your certified budget, so you know how much money you're working with. Then you figure out how you want to spend that money, and then you give that to your FMS, and they help fill in all the details.
Okay, right. The problem here is that I don't have the support of anybody. And I've been seeing emails from the regional center saying that they are paying, they're giving money for people to have the support during the transition. And
Right.
during the transition, I've been alone, all alone. Thank God that I have the person that have helped me, you know, all this time. He's excellent, he's wonderful, but we're all alone. I don't know who to reach, what to do, how to ask questions. Thank God that you have this right now, that I ask you this. So you're
Okay,
telling me.
all right, so I just want to make sure I'm clear on where you are so I can help you get to the next step. So you
Okay.
have a certified budget, you figured out what you want to spend your money on,
Mhm.
and you have already selected an FMS, a financial management service?
Yes, we did, but we tried to meet with a person and they haven't even responded to
Okay,
the
well
email
then,
that-
all right, well, that's a problem. If you've reached out to one, there's a lot of FMSs. There's not just one, you have a choice. So if
Okay.
you've reached out to one and you haven't heard back, then I would try another.
Okay.
Okay,
So
so it's the next piece is it's very important for you to connect. I know there's some FMSs on the call right now. They can definitely put their contact information. Do you have an independent facilitator, Eunice?
yes, I do.
So your independent facilitator should also be helping you find your FMS and working with them as well. That is their job.
Yeah, he's the one that have emailed
The
the
FMS.
FMS, and we haven't heard anything from that person.
So he needs to email them again or find a different FMS. There's about 10 of
Okay.
them, I think, in the state of California. I'm not all of them work with North LA Regional Center, but there's certainly probably, I don't know if John is on, if anybody here is from North LA or knows how many FMSs are vendored with North LA, but there's certainly a bunch of them, I'm certain. So yeah, your next job is to get to the FMS, how you want to spend your money. And what they do is they put it into this form that you don't have to worry about doing. That's their job. They get paid to do that. They put it into this form, which includes the service code, includes the per hour rate. Like if you're hiring a staff member,
Right.
you say, okay, I want to pay the staff member $18 an hour, then it'll be $18, and they've got to account for the taxes. You have to decide whether you want to be the employer of your staff or whether you want the FMS to be the employer of staff. So these are, but they'll explain that to you. The FMS will walk you through those choices.
Okay.
So I know for sure that that we can get you to you're very close to the end. You're really, really close to the end. We just got to get an FMS to call you back. So if that, there's a whole bunch of them on this call, so they should really put their contact information in the chat, and you can reach out to them or give it to your independent facilitator to reach out.
Right. My question is, what did the IPP and the new coordinator has to do with this situation?
Yeah, you don't need a new IPP yet. You will have an IPP when you are when you finalized your spending plan. That's when, so what you'll do is you'll have an IPP. Well, you will present your person-centered plan, your spending plan, and they attach that to the IPP, and then you move forward. And then after that IPP is when you officially get into the self-determination program. But it's too early. You're not ready for an IPP yet.
Oh, and then why are they bugging me that they're going to have an IPP? And it was on the 31st of December.
Yeah, so,
and I say, I cancel because I say, I don't think we're ready.
So Eunice, I actually have Richard Deere here, who's from the North LA catchment area. Richard, do you mind talking a little bit about what's going on there? Oh, you're muted. Richard, you're muted.
Okay. Hi, I put my hand up to be responsive to your question. Was there anyone here from North LA? I talked to Eunice offline, but I also wanted to encourage her to attend our local advisory committee on the 21st, Thursday at 7 o'clock. We have part of our agenda, which is called participant challenges and successes. And I've noticed that when participants come and report their challenges, we have a few people on the staff that really say, let's get to the bottom of this and find out what's going on. But I also wanted to say that I think part of the statewide barriers, but my regional center believes that they get to decide if your spending plan makes sense to them. And even as studied as I am and as successful as I've been in self-determination, I'm still having a regional center telling me that we don't want to do this until we review whether we think your behavioral plan is adequate. So you're facing some resistance, but my main advice is reach out to me offline. I'll send you my email, but definitely if you can, come to the committee meeting and speak up during that part of the agenda, so that we can have some of the staff make a commitment to you to find out what's happening with you. I have a lot of meetings that I call IPP meetings with my team at the regional center. So I call it an IPP meeting so I can record it. But IPP meetings don't always focus on just producing a document. Sometimes they're problem solving. But I'll talk to you about that. There's, every regional center has its own kind of personality, and I think I know North LA. So my name is Richard Deere. You can see that on the screen. My Gmail is richarddeere@gmail. So reach out to me and I'll send you an instant message so we can connect.
Okay, thank you so much,
meeting.
Mr. Deere. And I wanted to know, you say the meeting is going to be on the 23rd of January?
21st, Thursday.
21st? Okay, on
A
Thursday.
week from tomorrow night at 7 o'clock. It's on Zoom.
Oh, yes.
If you write to me, I'll be sure you have the link, but the link is on the website.
Right, I have that on my calendar from 7 to 9 advisory committee meeting.
Perfect.
Is that right?
Yeah,
Okay,
you'll be able to get a lot of your questions answered there for sure.
So
All right, I'm
Judy-
going to move on to
Judy, let me make a
Hi.
Thank you
Oh,
so
wait,
much.
Rick, did you want to say something? Sorry.
Yeah, just a quick comment, because I hear this all over the state. Judy, you do as well. I thought that Richard had this terrific word that he used, or phrase. There are challenges. This is not that complicated. The complication is not the reason why Eunice has not gotten her plan, has not gone live. It is the barrier or barriers that have been put up by regional center staff. So as I've said before, we are pioneers because we're new, and we have to continue to push and to advocate. I love the idea or the suggestion that Richard made, which was go to your local advisory committee meeting. It is really important for you to air whatever is going on individually. A lot of people attend these in some regional centers. None attend in other regional centers. And I'll tell you, it is the opportunity where the local advisory committee chair, the members of the committee, and regional center staff are there to hear your specific issue. So that's the solution here, particularly when you are so close to being finished.
Exactly. Thank you so much, Mr. Wood. I really appreciate your help.
Sure.
Thank you. There's some private messages going on, and I've gotten permission to ask somebody to speak because of something that she's heard. Miriam, do you mind unmuting yourself and asking your question? I know that she has to get off very soon.
Hi, I heard that the self-determination rollout was pushed back to July 1st.
And where did you hear this from, Miriam?
What's his name? Joshua Kaplan from North LA Regional Center. I talked to him on the phone. I think it was November. Might not be official, might have been changed again.
It was never changed. It was never on the table. Somebody else is saying in the chat that she's from North LA and heard the same thing. That's frustrating because another person saying they heard the same thing. It is not true. It is absolutely not true. It's also silly. Like, why would you move it from June 7th to July 1st? I don't even know what that's
May I
about.
say something? This is
Yeah, go
Carla.
ahead, Carla.
Because I was in a meeting today and someone said the same thing, and it was for North LA, but then it was a clarification saying that because if you can register on June 7, but you won't be able to get in self-determination until July,
Oh,
because I don't know, maybe you have to present the PCP.
oh no, because you have to start at the first of the month. Oh, I get it. I get what they're saying. Okay, let me explain it. I guess that's true. Theoretically, it is true. They can also backdate it. I can tell you that when I went into self-determination, it started on June 1st. My son was officially in self-determination on June 1st of 2020, but we didn't actually kind of finalize the IPP until about June 5th or 6th. So there is also that possibility that if you are really, really ready to go, they can get you in on June 1st, because nothing's been billed out on June 6th or 7th. But that's my regional center, which is highly flexible. Not every regional center is going to be highly flexible. The way that you can't like start in a program mid-month apparently, although that is a good advocacy thing that we should talk to DDS about, Rick. But apparently, regional centers have to start you on the first of the month. I don't know if this was a decision that DDS made. It's a decision that was made at the regional center level. I have no idea. But it basically means that you could have an IPP starting on June 7th and that you couldn't actually move in until July 1st. I actually think that that's not true. I actually think that if you had your budget meeting, you've presented your spending plan in May, you've gone through orientation in May, like we're planning to do mass orientations in May so that you can get started in June. Not every regional center is going to be doing mass orientations in May. That's why a whole lot of people are not going to be going in until 2022 at this point, because of how slowly the regional centers are reacting to this date that they have known about for 3 years. It's not like it's like, oh my God, where did this come from? We had no idea. It's like they have known about this since June 7th, 2018. And they should have been getting prepared for large numbers of people requesting self-determination. I'm hoping that all the local advisory committees are having the same conversation that we had last night at Westside, which is, how are we rolling this out statewide? When are we going to start orientations in April and May so that people can go in on June 7th, backdating it till June 1st? It can absolutely be done. I promise you, there will be lots of regional centers doing that, but there will also be lots of regional centers that will, obviously North LA will be one of them, who will not even consider that and will go to July 1st.
I mean,
regardless,
they can't even handle the small numbers. How are they going to handle? I mean, that's how it came up. I asked him, what's going to happen in June if you can't even people get in now? And he said, oh, we'll have 1 more month. It was pushed back to July. That's how I found out. That's what he told me.
Yeah, so that's obviously what we struggle. That's what this whole SDP Connect is about. It's like, if it's been so hard all the time, how are we going to get regional centers to really understand? And it's not just regional centers, it's also DDS. How are we going to, and then how are we going to get everybody up to speed? Remember that there are 5 principles of self-determination, and one of them is responsibility. And that means that we also have the responsibility to really become educated and to do the work to get in. Once you do the work to get in, it's actually so easy once you're in. Like, honestly, my service coordinator never has to talk to me. Like, I barely have any interactions with my regional center anymore at all, except to be part of the committee. So it's, we change things. We want to do different things. It's just like for us, it's like, here's a memo. This is where the money's going to go. And it should be pretty standard. So, all right, Cindy, go ahead. I know you had a question. Oh, wait, Rick, you wanted to have a quick comment before. Okay, sorry about that, Cindy. Go ahead, Rick.
Well, what I was going to say, I don't know whether it's Cindy Cox that had her hand up, but we at Kern have some independent facilitators, including Cindy Cox, who understand how to fast track those who are stuck, and have demonstrated successfully that they can get people unstuck and through the process. These independent facilitators, some of whom are on the call, are really important. And so what we know, and this is realistic, is that it does take time from the beginning, which is why mass orientations in May for those who are on the waiting list or those who want to get in are going to be so important. It takes time to select an IF, to then have the plan, to select an FMS, to get the budget approved, to have the spending plan completed. And that time, it could be a couple of months. It shouldn't be more than a couple of months. And we know from Kern, we've demonstrated that non-pilot participants, new people, have been able to be fast-tracked in within 60 days of selection and then getting through orientation. So I don't want, I know from being all over the state, Judy, you do as well, that many regional centers are taking 6 months or longer to get people in. It does not have to be that way. It gets back to my statement. It's not that complicated, but people have to devote the time to it. So advocacy is really important. And in advance of June 7th, I mean, you become eligible if you're not on a waiting list on June 7th. You're eligible. Everyone's eligible. There's no lists anymore. You just sign up. But that is simply the beginning of a process. And so in my mind, if somebody signs up on June 7th, there isn't any reason under any circumstances that I can think of, except maybe some extraordinary ones that I can't think of, that a person should not be up and running and in the program by September 1st, which is 2 months and 3 weeks.
If you're just getting started. But some of you, like Carla Lehman, has been asking for self-determination for years for her son, and she is ready to go tomorrow. So I think for those people who are ready to go tomorrow, they can definitely fast track in, I would hope by June 1st, if everything's kind of on the table. So that would be amazing. Okay, so Cindy, now I promise it is your turn. Are you okay?
I am.
You're laying down.
No, I'm sitting down. I had COVID last month, so I'm still recovering.
Oh, honey, I'm so sorry. I'm so happy you're actually recovering.
Yeah, I'm already like on my 6th week, I think.
Oh my goodness.
And I still have a lot of sequels.
Oh, I'm sorry. Be safe out there, everybody.
Yeah, it's paranoid right now. So my question was like, right now with COVID, right? I finally got Emily and self-determination this month. And they did back pay, not back pay, they did retro to January 1st, which my coordinator, was great about that. But now with all this pandemic, it worries me because I'm gonna give you an example. Like, I don't think I'm gonna be using right now a lot of the services that I have on the plan, on the budget, like Uber and some classes, because well, I'm paranoid right now, so I don't think she's gonna be using some of those services. So I asked the coordinator and she say they were gonna do like next year, like the budget is not gonna go under because we didn't use the services. So she say that no, because we're gonna put the pandemic effect about using the services. So I just want to make sure if that's true.
So what we're seeing right now is people doing, so there's a bunch of people who've already been in for a year in the self-determination program. Some of them have been almost, they're getting closer to their 2-year mark. And so what we've seen in this past year of the pandemic, that many people are coming in way under budget because they had on their budget plans, you know, taking 3 or 4 classes, going out, you know, having a community facilitator to help them make friends, you know, joining the gym, having a trainer, you know, all these really awesome things that you cannot access during COVID. And what we've seen pretty consistently, but I want to hear from those of you who can't, that hasn't happened. There's a very small number of people who have done their second IPP through the self-determination program. Is that what we're hearing is that regional centers are being very flexible and saying, okay, this is clearly unmet need. There was, or actually more of a change in circumstance. And there was when you did your spending plan, you were assuming that you would be able to be in the community. There was a change in circumstance. which didn't allow you to use all of your funds. And in every case I've heard, which is just a handful, I admit, but in every case I've heard, they put that money back in the budget and not just counted what your last 12 months were. Now, we may hear of stories where that doesn't happen and they say, no, we're not going to let you. And that, to me, can easily be brought to DDS to correct them on that. Because that's an easy one. I mean, you could also file for fair hearing, but I do think that DDS would get involved and advise the regional center to ensure that those funds are put back in your budget.
Okay, and then one more thing, like also I heard that DDS right now is waiving, like an example, right now I'm trying to move Alex into self-determination like as soon as possible because I heard, like I told you, he has a really, really small budget. But I heard that right now I don't have to pay the FMS.
Oh, yes. Okay. So that is a directive that just came out. Let me try to explain it in the best way I can. And those of you who do a better job, please chime in. So the Department of Developmental Services put out a directive a couple of months ago, basically that was backdated, that went into effect on October 1st, which says that you are able to take the monies that you were spending on the FMS and instead use those monies for programs or staffing that you would need because of COVID. You do have to use a reason COVID related, but that's really not a hard argument to make. Like we did this for my son, and we took the $150 a month that we were paying to our FMS, and that FMS now gets paid from the regional center directly and not through your self-determination program. So yes, they will continue to receive funding. But that $150 a month, we have added to a staff member, a budget for a staff member who has had to work extra hours because of COVID. And so it's a really easy argument to make. You just say, well, we're doing this now because of COVID. Of course, everything you're doing now is because of COVID. There is nothing else to do except respond to COVID right now. So
what happens when the pandemic is over and I don't have the money to pay for the FMS, but I'm already on self-determination? How am I gonna keep paying for the FMS?
No, you will, Cindy, because they do it on a month-by-month basis. Yeah. So for now, we've just gotten the $150 from October, November, and December added to his budget. So it's the money is still in his spending plan for January, February, and March, and on a month-by-month basis, it gets added in so that we don't lose that. So we're not overspending our budget. So it will not happen. You don't have to worry about it.
No, I know, but when the pandemic is over and I'm already in self-determination and we have to start paying for the FMS, right. And I don't have the budget for the FMS because they took it away.
No, the money stays in your budget. They don't take away that money. It's just different. It's like, so instead of spending that money for the COVID related expenses, you're no longer going to be in COVID. So you don't need those COVID related expenses. And that money will go back to the FMS. So for my son's aide, who is working, about 4 or 5 hours more a week than he normally would because of COVID, we at one point actually had to move in with us because we were so afraid to have him out in the community that he might bring in COVID. But so you have them working with you for more hours. That in that way, once COVID ends, he's not going to be having to work those extra 5 hours. So that money will go then to your FMS.
That part I got it, but like Alex is not gonna have the budget to pay for the MNS once.
Oh, FMS, because his budget is so low. Yeah, well, that's a different issue. That is a totally different issue. And a lot of small children have I know he's not that small anymore, but a lot of children have very small budgets because they're getting maybe 20 or 30 hours a month of respite, and that is that's all their services.
But can I request then like an increase of budget due to circumstances, because I'm already gonna be on self-determination? So
not at this time.
No, after when they go everything to normal and now the budget, the FMS has to come out from the budget.
Yeah. At this time, the regional centers don't have the flexibility to say, oh, we're just going to add that money in because she spent it, because those were only expenses for special expenses for COVID. Now, let me say this. We are advocating for this to be a permanent change, that the FMS budget, that the FMSs don't come out of budget, or at least our backup plan is that it doesn't come out of small budgets, so that people like your son don't have to have that $150 pulled out every month or $100 pulled out every month. So, so we're advocating for that to be a permanent change. We have not succeeded. I mean, it's not even being considered at this point. It would have to be considered sometime in May while the budget is being considered for the state. But we think that that is a really important thing, particularly for children who often have really tiny budgets. So keep, you know, maybe we'll use Alex as one of our prime examples, that look at during COVID, how he was able to really get staff to help him. And now after COVID ends, his budget is so tiny, he can't even afford the FMS. So, so yeah, so we're hoping it'll be permanent, especially for those people with small budgets.
Okay, thank you. So I'm gonna do the
Absolutely.
transition as soon as possible for him
All right.
too.
And please take care of yourself.
Yeah.
I'm very worried about you. I didn't know you had COVID.
Yeah.
Mari, your question, please.
Yes, hi, do you hear me?
I sure can.
Okay, I just have questions. I'm a little confused in regards of this service directive that you're talking about when it comes to the FMS. So what you're saying is that this directive is only effective for those who are already approved for the to be part of the self-determination, but for those who are going to enter in June, like my son, that directive is not going to apply to them. So the money for the FMS has to come to his budget, or I'm a little confused about that.
Yeah, so certainly everybody, as you're looking into the June spending plan in your budget, you should definitely count on the fact that the FMS is going to have to be paid out of your budget at this point. It's possible that the state of emergency will go beyond June. The way that the vaccine is getting rolled out in the state of California, I wouldn't be surprised if it is extended into the fall, because things are moving so freaking slowly. However, we don't know that. So you should make this assumption it's going to be pulled out of your budget. And then if it's not, that's great. You can use those additional funds for providing extra supports during the state of emergency.
I see. And one more question. Like I said, my son is not there yet, but I remember it was the self-directive for those who to pay for that. It was a PCP, if I'm not mistaken, the 2,500. That's still effective.
Ask that in the chat. We don't have, Rick, do we have an answer from DDS on that, whether those person-centered planning funds are going to be available for people in June?
We don't have an answer, and that's one of the things that, that's one of many things that have not yet been considered. I mean, when you think about how poorly the rollout has gone and where the blame lies, if you will, it really is a sort of a lack of foresight and planning. I don't have the answer to that, but I've just written it down as a note to discuss with DDS. I don't know. I do know this. Those funds for this first year of the plan, the very first plan, those are really important funds to get to the families and the consumers that go into self-determination, because this stuff takes time in that first year. And so we can certainly make a compelling argument for them to continue. And we know that there are funds that are available from sources that we don't have to talk about just now, but there are funds available every year for self-determination that come from the savings that arise out or come out of the waiver that was approved by the federal government. So I don't know, but we'll see whether we can answer that question in the next month or two.
Okay, thank you.
Thank you, Mari. Carla.
Hi, I just also, because what Cindy was saying regarding the directive, I have a client that is from the same regional center as Cindy, and we asked for it and they said, oh, we're already covering all your COVID, needs. That was their answer. And actually is that regional center is especially the ones with the lowest budget. She's like, like we're fighting for everything. Is really hard. And that's where their answer. And everything is a fight. So, and we, like, she was trying to get even more like respite hours, everything. And so that's what their answer. And I know other regional centers, I know we talked about it yesterday with Westside, and that's great that they're doing it. But I know other ones that I asked, not all of them, but some that I asked, and they said, we don't know how to do it. We're looking for more direction. And the FMS also didn't know how to do it. I talked to 2 different FMS, and they said, we don't know what to do. We're waiting for direction.
Yeah.
I don't know.
Yeah. So this is where I'm going to say what I've said in the past, which is file for fair hearing. You absolutely should file for fair hearing. This is ridiculous for them to argue with you over $150 a month.
I know.
It is just, to me, like absurd that they're doing that. So
Yes.
Go ahead, and in the meantime, remember, it just takes a minute to file for fair hearing. It's a simple. Sally Campos is on this, and she's like the biggest advocate for filing for fair hearing because she has won like dozens of times. So Sally, you can chime in, but it's just file for it. The regional center will come to the table and go, oh my God, there's Sally saying, yes, don't wait, argue or stress, file for due process. It's really, it's $150 a month, and you have to have a reason you're filing for it. You have to say, okay, we want to pay this person who makes $18 an hour to work for another, 3 hours a week. Really, it doesn't pay for $150, does not pay for a lot. Just make sure that you use the word COVID in there, that your needs are COVID related, which as I said before, everything should be COVID related right now because nobody's out in the community. Nobody should be doing anything other than staying home and being protected. Mm-hmm. So if you need additional funding to stay home and be protected, you should ask for it. You should know that there are lots of people in the program who don't need this extra money. Their budget is totally sufficient for them. They have gotten what they needed, and they don't need to go back and ask for it because they're doing okay. But for particularly those people with smaller budgets, this is a really great tool to be able to make sure your child is supported. So maybe it's like, I just have an extra caregiver for the school day because I have to work. Like, that's COVID related. That kid is normally in school hours, but it's COVID related that they're home.
Yeah, she just went to fair hearing for 10 hours extra a month for respite, and she lost. So I don't think she's gonna be wanting to go again to fair hearing. So, and that regional center was really, really hard, to be honest.
To win extra respite hours, you really have to make your case, and you have to do it in a very clear way. This is what the child's schedule is all day. This is when I'm available and when I'm not available. Cindy should have been getting tons of extra hours because she's had COVID for 6 weeks. This is when to step up.
My client too. She has COVID now.
I'm barely gonna meet up tomorrow with them because it's been over a week or 2 weeks and they still hasn't responded me for any support.
This is what the governor of the state of California gave DDS all this extra money, and DDS is so proud of the fact that they have these extra funds to help families affected like Cindy. And to me, the fact that you are having to do this, they're fighting for this while you're so sick, makes my head want to explode. It really, really does.
And I asked the coordinators, and they said the only thing we do is give you the mask and the gloves, and that's it. And then like once a month you can come and get tested, and that's it. And I asked different regional centers.
That's not true. That's not true.
My coordinator too. He said the same thing.
Just spend 5 minutes looking through the COVID site on the DDS website, and you'll see all these really awesome things that you have access to during COVID. Tons of it.
Regional centers are not doing, at least the ones that I asked, they just said no.
All right, thank you. Sunny. I'm
I-
here,
th-
Sunny, but I'm in New York and I turned the heater on in my room too high. So I'm hearing everything you say. I'm just walking over and turning
Okay,
off.
I'm going to keep this really brief because I have wanted, this is going back, I wanted to talk about the funding for, a lot of people have been asking me, funding for person-centered plans to start to get ready for June.
Right.
And Rick addressed this already, but I just want to just throw in one more comment about it, which is that people are asking for it. And what I'm concerned about and what I'm starting to see is people who can afford to pay for it are going to start paying someone to make a person-centered plan for them so they can be ready for June. And people who can't afford to pay for it don't have that option. And it's going to be the haves and have-nots come June about who can access the program. And I'm really concerned about that. You know, I would like to know, and I know lots of people would like to know what we can do to advocate to get DDS to make a decision on this and not let that happen.
Mhm.
I can do that. And I get it. So I appreciate that. Thanks, Sunny.
Okay, Sally. Oh, you're muted, Sally.
Unmute. Okay. I just put in the chat an easy way for people to increase their budget so that once they get on self-determination, it's considered. It's basically a roadmap so that, and then I put my phone number just in case anyone wants to call me for my experience, and I could guide anyone on how to navigate the due process. I'm sorry that girl, that parent went through 10 hours of due process. That's rare. Usually they will do that in order to discourage, which has happened. Like Carla said, she doesn't want to go through it anymore. But they did that to me and that kept going. And the other 12 that I filed, I never went through due process. The first time I did, and I lost, but I kept filing. And so I showed fortitude, I showed courage, I showed that I was not afraid. And then from then on, I would just settle at mediation. And I would get services and services and services for my daughter. Like was noted here, check the services site and then just go through and get services for your kid, because that determines your budget, unfortunately. But it can be done.
Thank you, Sally. You are inspiring to all of us, because for many of us, we have found it quite challenging to go through due process, but or as Elizabeth Gomez calls it, unfair hearing. So I think that I might actually have you do a training for us, Sally, if you would be open to that, because I think that people would love to hear it from an experienced parent. That would be great.
Sure. I also want to share that I did go to my advisory meetings, and I would share every single time. I would voice my concerns, and that never went anywhere. So it just, the easy way, the fast track is fair hearing. And that got me a lot of really quick services, very good services, a lot of money for my kid. And it was, I just want to encourage people to do that. And the more fair hearings they get on self-determination, the more attention we will have as parents. Don't stress, don't wonder why they don't get back at you or deny you or none of that. Just file. And it takes one sentence. So yeah, I'll make the process. It's just, I'm not satisfied with respite hours. Why? Because there's a need. It's just one sentence, file it, sign it, and then they ask you for details afterwards. Very easy. 15 minutes. 5. Thank you.
Wonderful. Thank you. Hi, Christina. Happy New Year.
Hi, Happy New Year. Thank you. Hi, Judy. Hi, everybody. Okay, I just have a couple things. One, with regards to what Sunny you just mentioned, I reached out to DDS. They reached out to our regional center. I have a meeting next week. We're in North Los Angeles, but I have a meeting next week with our executive director and the head of community services regarding funding for PCPs ahead of time. What DDS told me, and I'll read you exactly what they said. They reviewed your inquiry internally with management in regards to the PCP service code. Regional centers should be aware of the codes that could be used to fund a PCP through a vendor provider. If you have requested this service and they have denied, you are able to exercise your right to fair hearing process. If you have not received a notice of proposed action, you may verbally request a fair hearing from NLACRC. So they did reach out to North Los Angeles. I'm gonna try to figure out with them how it will work. Obviously, it's not just for my son, but it's for everybody else who wants to get into SDP to try to move things on like ahead of time, right? For us to start doing this now. The other thing is, for those of you who are not in SDP, I know some people said they tried to get respite, they were denied. So the participant directed services, which was out March of last year, it includes personal assistance. So they may not give you respite, but then you have to ask for personal assistance. Any anybody who was in either a day program or in school is not in school right now. So you should be able to get, and you have to specify, it'd be Monday through Friday, 4 hours or 6 hours or however many hours you need when you're the consumer normally would be in a program or at school. Request that's what you need personal assistance for during COVID. It took us 9 months to get it, but we finally got approved. However, we're trying to work on getting the FMS we want to use, but that's another issue. So one question I did have for anybody who is independent facilitators or who do PCPs, are you vendored with regional centers or are you vendored with the FM? You get paid by an FMS, is that correct? And how, that vendor word that DDS is giving me is the question that I had for you guys.
Anybody want to take that, Diane?
There is a vendorization process once you're an 024 with a regional center. So it's how you get paid by the regional center, but you're not a vendor of the regional center.
Right. So that was perfectly said. And it also, by the way, is different at each regional center, which makes my head want to explode again. But basically, you don't, if some regional center says you need to fill out the 20-page vendorization package, that's not true. You do have to give them your W-9 form, and you still, because they're paying you, and there are tax issues and employment issues there as an independent consultant. But there is some forms that they have to sign and submit, but they should be pretty basic, like when you're a consultant to an organization. And that's about it. If some regional centers are saying, no, you need to complete the full vendorship packet, which is really complicated, that's just not the case. Some regional centers are being so flexible about it. They're just saying, just send me the bill and we'll write you a check. I know that, I'm not sure if it's still that way, but South Central used to be like that. They were being super easy about it, but others were requiring you to get a vendor number just to fill out a very simple set of information and give you a vendor number to get you paid.
Okay, so if somebody has already been doing PCPs at North Los Angeles, we should be able to use them. Okay, great.
No, wait, Sunny's saying no.
Because it's very confusing because you use the same word in two different ways.
Yeah.
To be a vendor of the regional center means that, is my understanding, means that you have gone through that longer process. You have a program design filed with the regional center that says exactly what you're going to do and how you're going to do it, and you are vendored to provide a specific service. In this case, you would be vendored to provide person-centered planning. That is not what most independent facilitators have. Most independent facilitators have just a vendor number, which is basically just like an account number in the billing system, like Judy just described, so that we can get paid. But we are not vendored to do anything other than just be reimbursed for our services. So we would not be considered, as far as I know, vendored providers for person-centered planning services. So my understanding is if they say you can use a vendored provider for person-centered planning, my understanding or my interpretation of that would be does not apply to most independent facilitators. It's going to apply for things like day programs that offer person-centered planning, which in my opinion is a big conflict of interest.
Correct. And it's not the same. And that's okay. That's very helpful, Sunny. So, because when I have the meeting, I want to make sure we're asking for what we need. I want PCP or independent facilitators who are familiar with SDP. I don't want somebody just doing, it's not just a regular PCP, it's specific for this. Okay. That's good information. Thank you.
This is Richard Deere, and I agree with Sunny, particularly related to North LA. My advice is you ask them for their list of vendor DCP providers, so you at least know if there are any.
Okay, thank you. And then side note, with personal assistance, I found 3 agencies that were going to be paying at the lower rate. So you need to specify with person or participant directed services, they should be getting paid $16.25, the minimum. A lot of them are paying $15 because that's what they normally pay under traditional services. So I had to go through a whole process to get them to pay higher because they're getting reimbursed at a higher rate. So just want to put that out there.
Interesting. That's really actually super helpful. So I'm just going to take one more question from Mari and any final words from Rick, because I actually have to go to the South Central Local Advisory Committee meeting starting in 4 minutes. So go ahead, Mari.
Thank you, Jenny. I have just well, I actually have those questions, but you can even answer one right now. You don't have much time, it's fine. When it comes to the going to dual process, I know, I hear that, in this meeting recommended for families to go and just go to the fair hearing. But a lot of families are afraid of going there because some are saying that some judges, they don't even have a clue of what self-determination is, or they don't have that very clear. So, they go there with, like Elizabeth says, some fair hearing because they don't have a lawyer to go with them. And on top of that, they encounter this new program that the judges are not even, informed or have a clue what exactly it is. So most of them are going there for nothing.
Yeah, Richard Deere sent me a private message making that exact point. I have to tell you that a lot of the judges have never heard of the self-determination program before. And so what you're doing, but here's the thing that I'm going to tell you all, is that they don't necessarily have to yet be experts on the self-determination program, because in the initial hearings that they're having, it's going to be around you asking for services in the traditional system, not you asking for services through self-determination. So they understand the traditional system. They understand the service codes and respite and supported living services. They understand those services. Once people now are into the self-determination program and they are trying to make the case for unmet need or a change of circumstances, starting in the next year or two, they're really going to have to understand the self-determination program. But right now, all of the fair hearings that I'm hearing about is that you are asking for a service through the traditional system so that that service can then be added to your budget or the amount of money you pay for that service. So if you understand what I'm saying, when you go to fair hearing, it's not going to be about the self-determination program. It's going to be about you accessing services through this traditional system.
No, I get that part, but sometimes, like the coordinators bring that into the conversation when you are on the fair hearing, when you're transitioning, and it's when it gets a little messy because the judges don't get it, and they.
Yeah, no, I'm sure that happens. All right, quick comment on that, Richard. Oh, you're muted though. There you go.
Just want to actually give the quote: in a fair hearing regarding self-determination, the judge who had been at a fair hearing with my son 20 years prior, so he's been around, actually said this to me: "This SDP program real, or is it just a parental wet dream?" And so he didn't get any of my points about the principles or control of the budget. So I'm really afraid to go back on something that's at all nuanced.
Right.
But I hear that they've been trained or are going to take up the responsibility to get familiar before they issue decisions. So
yeah, we've been asking DRC to maybe try to do a training of them. I don't know if that's ever been in the works. I know that at one point we had Katie Hornberger on the call today, but I think she had to drop off. So, all right, I need to end only because I and maybe others in this call need to go to the South Central Los Angeles Local Advisory Committee. I want to thank this amazing turnout on our first meeting of the year. And I am really, really happy for all of you to come. I think we may do one next week, maybe the week after. I haven't really planned out anything too much in advance yet because we're kind of living day by day right now. But you will make sure you're on our mailing list. We're at disabilityvoicesunited.org, and you can get on our mailing list through the page. Sally Compa just put it on her email. So what I'm going to do is have Ed, if you can just stay on for like another couple minutes, because I'm going to pop off. So that people can go through and grab those emails if you need them. Thank you, Rick.
You're welcome.
And aloha.
Yeah,
Mahalo.
I'll be at the same meeting, Judy.
Oh, you will? Okay. We'll see you in a couple minutes, in a minute.
Let me make one comment,
10
seconds, and that is this. These are the questions that we're seeing today and that we've seen in other SDP Connect meetings that we expected to receive. This was the purpose of this 3 years. It wasn't just to meet the needs of 2,500 people. So all of these questions are good. In fact, most of them really good and informative for me, and to the extent that we can be your advocate, or that I can be your advocate with DDS and others, I'm prepared to do that. So keep the questions coming, because it's the anecdotes that are really important. This is what people are experiencing. And ultimately, as we gain critical mass, those questions are going to be answered. So once again, we're pioneers just slogging our way through. So stay with it, hang with it.
Pioneers. All right, everybody. Thank you all. Please stay safe. Ed, stay on for just one more minute for people to find it. Thanks, everybody. Take care.
All right, everybody, it's been about a minute. I am going to shut this down. I just want to let everyone know that the recording of this SDP Connect call will be available within about 2 business days. And I look forward to seeing you all on the next SDP Connect call. So thank you very much.
Thank you.
Thank you.
Bye-bye.